I'm Premila Naidu. I'm a pediatric dentist in Bangalore. It's during the third year of my graduation when we get introduced to all the specialities, and that's when I realized that I really want to do pediatric dentistry in my post-graduation and start a kid-friendly clinic. That's when the whole journey started. I started our first exclusive pediatric dental clinic in the year 2007. I was not even a postgraduate then, but yes, we started our clinic then. I finished my post-graduation in 2009, and since then I've been working on making more and more kid-friendly dental clinics. Also along the line we have put in more effort and thought on understanding how we can make these places more inclusive and accessible for all children. Yes, so I really don't know how to answer this question, but I think children itself are very different. Each child is different, and if we are talking about a neurodiverse child or a child with special needs, there is just a little more increase in the differences. Actually, as a pediatric dentist, for me, it doesn't make a significant difference on how I would handle that child. Only thing I feel all children need is the time and the confidence. If we give enough time in understanding what is overwhelming them, and if we show enough confidence that yes, we understand and we can handle what they are scared of, or we can handle their anxiety, most of the children sense that and behave very differently. So again, coming to your particular question on what could help a dentist handle a child with neurodiversity, I think the answer still remains the same, just the time, the confidence, and just make sure your non-verbal communications are in sync with what you're trying to say, and kids will perceive and make a lot of difference on how they regulate themselves on the dental chair. So what can we as pediatric dentists do, or what we can do as any person to make places more inclusive, is the subtle changes to make the place multi-sensory, because everyone doesn't perceive the light or the sound or the tactile in the same way as the other person. So what we've done in our clinics is we've given a lot of opportunity for tactile sensation for the child. We use a lot of play therapy before and after the treatment to help the child calm down. We also have an option of regulating the amount of light and the type of the light the child would want in the room, from the typical bright white light to warm light to even subtle blue light. Audio visual distractions help a lot for the children. Giving fidget toys helps, and even noise cancellation, earphones. These are small things which can make a whole lot of difference for children in general and neurodiverse children in particular. Along the way, I started reading about multisensory approaches in general for like cafes and design concept wise. And the more I read, the more I understood that how it has a widespread benefit for children and adults. Any day sitting on a metal chair would be uncomfortable compared to sitting on a sand or on a grass, right? Those are subtle things. And actually one thing that I read up which I come to my mind is that we as humans are sensory beings, and the more we deprive ourselves from this various sensory stimulus, the more difficult we would become emotionally also. So that's how the whole concept of sensory adapted dental clinics came in, and we have 3 of them now across Bangalore, which I'm super happy, and I hope more pediatric dentists and doctors join the So ISPPD, that is Indian Society of Pediatric Dentistry, conducts a course every year for oral health and dental care for children with special healthcare needs. I'm proud to be associated with them for 4 years now, and we have trained more than 150 pediatric dentists to make their clinics more inclusive, accessible, and train them to handle children with special healthcare needs even better. And I've been a part of that association, and I've been concentrating and focusing on the clinic designs and how to help our neurodiverse children handle the dental appointments better. So my message to the community in general is that to make places inclusive and accessible, it actually doesn't need much. I truly believe that it just needs a thought in that direction and a little bit of awareness. So I would really want to send this message across. Let it be office spaces, let it be schools, preschools, any common area, wherever we can, we should be making the places more accessible and inclusive for the neurodiverse children and adults, because they can do so much more if we can just provide the right environment. I think we should be providing the right environment more than them trying to adjust into what is set already, which not necessarily be the right way. So please, let's be more aware and let's make those small changes. It should really help.